So the Royal Cornwall Hospital is the only acute hospital in Cornwall. It's got about 650 beds and covers 3 sites. The main site's up here in Truro, but there's also a site down in Penzance and in Hale. We cover the population of Cornwall, which is about 500,000 members of the public, and then that goes up by another 300,000 during the summer. So I'm the chief pharmacist here at the Royal Cornwall Hospital, and I look after a department of about 100 staff. So we've got 20 or 30 pharmacists and 20 or 30 pharmacy technicians as part of that team. And we have many roles within pharmacy. We make chemotherapy drugs up, we supply medicines like you would in a community pharmacy, but one of the other roles we do is up on the ward supporting the nurses, the doctors, the junior doctors, and supporting the patients up on those wards to make sure that they're getting the most out of the medicines and that we're using medicines safely in the hospital. We've been using Guru for over 2 years now. One of the main roles of the clinical pharmacist when they're up on the ward is making sure the patient is prescribed the right thing. Now, about 5 or 6 years ago, NICE and the National Patient Safety Agency came out with an alert around something called medicines reconciliation. And the evidence shows that when patients are admitted to hospital, that first prescription the doctor writes, that doctor makes unintentional errors or discrepancies in 30 to 70% of occasions. So maybe they prescribe something that had previously been stopped, or they prescribe the wrong dose. And that's where medicines reconciliation comes in. So the pharmacist and the pharmacy technicians will look at that prescription and compare it to the GP records, to what the patient's brought in with them, and actually make sure that what ends up being on that prescription is the right thing. And that can be really important because otherwise patients can miss crucial doses of medicines, they can be given the wrong dose of a medicine, or they might even be given a medicine that was stopped months ago. So it's a very important patient safety step of the pathway through the hospital. Guru allows us electronic access into and remote access into that GP record. So previously we'd have had to phone the GP practice and ask them to fax through to us a copy of what the patient was taking. That's obviously very limiting because you can only do that during GP opening hours. So weekends, in the evenings, lunch times when GP practices might be closed, you can't get that record. So I tend to work clinically at the weekend. So if I'm working, if it's in the dispensary or up on the wards, rather than not being able to do that medicines reconciliation, I can just dial into through the Guru product and be able to get that history. The clinical pharmacy team that we have, so there's a team of about 30 pharmacists and technicians that go up to the wards every day, and one of their main roles is getting that medicines reconciliation completed. That's one of the first steps we do when we get to the wards. So they use it extensively during the day. The old way that we used to do medicines reconciliation meant phoning up GP practices, speaking to the receptionists there and getting them to fax through the medication history for that patient. Now that's quite a time-consuming process. Now by using Guru, we reckon we save at least 10 minutes per medicines reconciliation. When you're doing 1,500 medicines reconciliations a month, actually saving 10 minutes on each meds rec is a really big time saving for us. We identified that we had quite an inefficient process with our medicines reconciliation, and we were looking for solutions, and the microtest team came in, showed us their product, and we realised immediately that that was exactly what we needed. So they went away and tweaked it slightly so that it was appropriate for the pharmacy department to use, and then we started the training program here of our staff, and it's a really simple system to use, and really the training was more around the information governance and the consenting of the patient side of it rather than actually how to use the system, because it is so straightforward. Guru would have benefits in other areas, such as the emergency departments, such as the community MIUs, the medical assessment units out there, and the GPs out of hours. For them to be able to get direct access into primary care records of patients would be really beneficial for patient safety. And because Guru is adaptable, if it's an emergency department doctor, they can see more of the history than we would as pharmacists. They could see all the medical bits that are relevant to them. So it's got a lot of applications across lots of different environments, and because it is configurable and easy to use, and I think it's got a really bright future, and I would recommend other hospitals to look at it and to take it on.